What's up, everybody? Dr. Bonzo back again with another quick-hitting, high-yield review of a medical topic in 5 minutes or less. So we're going to continue our contraception theme, talking about birth control, and we're going to pick up where we left off last time. For those of y'all who were with me last time, you remember we were talking about progesterone-only methods that were long-acting. So we ended talking about the progesterone IUD specifically. And if you remember, we talked about a couple things. One was that we talked about inserting an IUD when somebody has a sexually transmitted disease or an STD. So we said that when you have an IUD in place that's being inserted, if you catch an STD, then your risk of pelvic inflammatory disease or PID is a lot higher. So because of that, you have to be very, very careful to make sure you treat any STDs while you're inserting the IUD. For some of y'all who are learners or students who are taking tests, you may actually see that listed as a contraindication, being a woman who has a history of frequent STDs as a contraindication to IUD insertion. In real life, a lot of people feel that the risk-benefit profile when you compare an undesired pregnancy versus the risk of catching IUD is in favor of preventing the pregnancy. PID is a relatively rare complication of IUD insertion, but it is something possible and something to be aware of. Again, if somebody has an STD at the time of insertion, it has to be treated on that same day. So we know about the difference or the similarities between the different IUDs because those same rules that apply to the progesterone IUD apply to the copper IUD that we're going to talk about today. But there's one huge difference in terms of mechanism of action. So last week we talked about progesterone-only IUDs thinning that endometrial lining and as a result causing lighter periods or no periods for most women. The copper IUD is kind of the opposite. So the copper IUD's mechanism of action is that it causes sterile inflammation. For our learners out there, remember that term, they love the quiz you on, sterile inflammation. So it's a copper foreign body, it's kicking up dust there, hostile environment for sperm to get in, hard for them to fertilize an egg. Also hard for implantation to happen. So that's how it works. The downside of that is that that increased inflammation causes heavier periods for some women. So the copper IUD should not be used in women that have a history of menorrhagia or heavy periods. Last time we mentioned that the progesterone-only methods, some of them are actually FDA approved for the treatment of abnormal uterine bleeding. The Mirena is actually approved for the treatment of heavy periods. But the copper IUD will cause heavier periods, especially in women who are already prone to it, and should not be used in women with heavy periods. So you may ask, why in the world would somebody want to use the copper IUD since it causes potentially this heavier, nastier bleeding? Well, one is the mechanism of action leads to a lot longer method of birth control. So we mentioned the progesterone IUD lasts anywhere from 3 to 5 years. The copper IUD lasts for 10 years. So in addition, some women don't really like having hormones. Some women say that hormones cause mood swings or acne or all kinds of different problems. And some women prefer to have something that is a naturally occurring element like copper that has no hormone in it. So now again, we know about IUDs. We know about being careful with STDs when you're inserting them so they don't end up with PID. Boy, that's an alphabet sandwich. STDs with PID and IUDs. But I digress. We know, be careful with that situation. We know that the progesterone methods last 3 to 5 years compared to the copper lasting for 10 years. Progesterone tends to give you lighter periods. Copper tends to give you heavier periods. And we know about the differences between those and the similarities now. So the last thing to talk about is some unique things to the copper IUD. In particular, its use as an emergency contraceptive. So a lot of times when you hear emergency contraception, you think about things like Plan B, right? The pill you can buy, you take 2 pills, you take another dose 12 hours later, and then you're done. But the ParaGard or copper IUD inserted within 5 days of last unprotected intercourse is the most effective form of emergency contraception. Anyone who might be taking tests in their world in the future, remember that factoid. The copper IUD is the most effective method of emergency contraception that is available, more than 99% effective if it's inserted within the last 5 days of unprotected intercourse. Also keep in mind that women who receive the copper IUD as emergency contraception, they tend to stick with it. So in one study, almost 95% of women who got a copper IUD for emergency contraception still had it in a year later. And between 80 and 85% of them kept it for longer periods of time for several years. So in summary, we know about copper IUDs, we know about the sterile inflammation, we know that they last for 10 years, we know that they can cause increased bleeding or heavier bleeding. We know to be very, very careful in women who have a lot of STDs. Especially if they have any STDs at the time of insertion, be sure you treat them when you are inserting the IUD. And there you have it, a review of copper IUDs in 5 minutes or less.